Good evening, everyone, and a happy new year to everyone who is joining our first Facebook Live Q&A of 2021. Of course, this is not the start to 2021 that any of us would have wanted. And that is why we want to keep holding Facebook Live sessions so we can give local residents the opportunity to ask us directly about the latest public health guidance and any other key issues for the city, like the council's budget. For those who are unfamiliar with the format of these sessions, I will shortly ask the panel to introduce themselves and then we'll begin to answer any questions that you may have. This week, I'm joined by council colleagues from Public Health, Education and Finance, as well as Phil Mettam from the Vale of York CCG. And Phil is going to be joining us a little later and hopefully will pop up onto your Facebook screen. We look forward to discussing your questions, particularly on the new national lockdown and the latest proposals for the council budget. Before I ask our panellists to introduce themselves, I would like to touch on a number of key topics from the past week. As announced by the Prime Minister on Monday evening, we are once again in a national lockdown amidst increasing rates of infections across the UK and here in York. To just highlight how quickly things have changed, a few weeks before Christmas, York's infection rates were well below both the regional and national averages, but have increased sharply. Therefore, it is absolutely vital that we follow the new national guidance, stay at home where we can, and look after each other during this difficult time. On that point, whilst we remain under lockdown restrictions, we must look after ourselves both physically and mentally. Should anybody need support, the council is on hand to do what it can. You can call our helpline 01904 551 550 or email covid19help@york.gov.uk, and those details will be put up on the chat section of the Facebook page. Moving on from the lockdown, the council is currently in the process of setting a new budget for the city. With the huge economic impact of the pandemic, this will be an important budget for the city, particularly as we look to build back better from this crisis. Our proposals for the next council budget are published online, including new investment for adult social care, support for children's services, and a new £3.5 million COVID recovery fund for the city, which will include investment for mental health services, carers, businesses, and more. Our consultation on the budget is open until the end of the month, so please do take a look and have your say. Now I'll stop speaking at this stage and ask our panel to introduce themselves, and I'll go in the order that you happen to be on my screen. So first, Debbie.
Hi, my name's Debbie Mitchell. I'm the Chief Finance Officer at the Council.
Thank you very much. Nigel.
I'm Councillor Nigel Ayre. I'm the Executive Member for Finance, Performance and Major Projects.
Thank you very much. Fiona.
Hello, I'm Fiona Phillips. I'm the Assistant Director of Public Health.
Thanks, Fiona. And Maxine.
Good evening. I'm Maxine Squire. I'm Assistant Director for Education and Skills.
Thank you very much, Maxine. As I said, we'll be joined a little bit later by Phil from the CCG. So I'd like to thank the panellists for their time in coming along today. It is Nigel and Debbie's first ever Facebook Live. I don't know how they've managed to escape. As Maxine and Fiona will say, that they've been caught up in a few of these, but we find they're a really good way of getting out information and answering questions directly. So hopefully, Debbie and Nigel, you will feel the same by the end of the hour. We do have a number of pre-submitted questions, and I'm going to ask a few of those first. And I'd like to thank everybody that have sent in questions in advance. But as well as that, do post any questions that you have on the comment section on Facebook, and we'll pick up as many of those questions as we can. The themes that we're going to be looking at today are the council budget, schools and public health and the new national restrictions, as well as the rollout of the vaccine. But obviously don't let that restrict your comments or questions on the page if you want to ask us about something else. And one of my colleagues from the communications team will also answer your questions on the comments page and continue to answer your questions after the Facebook Lives finish. So do keep watching it, or if you're watching it back afterwards, again, please do keep asking us any questions. So the questions that we've had in advance about the council budget, most of these are going to be directed to either Debbie, Nigel, or I might answer one of them. And the first question that we had was, I've seen in the news from councils like Leeds and Birmingham that the pandemic has crippled their finances. How has the pandemic affected York Council financially? And I'm going to go to Debbie first, and I'm sure Nigel or me might want to chip in as we go. Debbie.
Yeah, so in common with most other councils across the country and many other organisations, we've seen costs increase across a range of areas, actually. So particularly in social care, both adults and children's, we've seen increased demand for those services and increased cost of those services. In other council-run services, we've had increased costs because of either people quarantining or isolating. So things like waste collection, where we've had to bring in additional operatives to carry on collecting waste. We've also seen losses of income across all services, the main one being car parking. So clearly, as the national lockdowns have happened, people haven't been driving into the city and parking their car, so we've had a loss of income there. We have had some government funding, but it hasn't been enough to cover all those costs. And actually, the regular monitoring reports that we send to executive do have a lot more information in terms of the types of costs and some of the pressures. I think in terms of how it's continuing to affect us financially as well, you know, we're in a period of uncertainty, all of us, and that's a national picture. And when the government gave us our funding settlement in December, just before Christmas, normally they would do that for a longer period, say 3 years, but they've only done that for a year this time. So that makes it really difficult for us to plan. So obviously we've just gone down into national lockdown again, and in terms of lost income and other recurring spend that might be needed over the next weeks and months, it's really unclear. It's really difficult for us to forecast the financial impact.
Thank you very much for that. I should have said as well to the panelists, if you ever want to come in and make a comment or a supplementary comment, if you raise your virtual hand, although people watching won't be able to see that, I will, and then I'll know to bring you in at that point in time. I think that the other thing that I would add to Debbie's comments is about our Back York campaign. So throughout the pandemic, we've been reminding government that back in March, they said to all local councils, do what you need to do to support your community and to support local businesses. And we have done, and we have been trying to do as much as we can do, but they haven't paid for everything that councils have done as a result of the pandemic. And in many ways, for example, that council tax increase has been passed on to local councils, to us and to all others that deliver social care, because we haven't had the costs of meeting the challenges that have come up with the pandemic, and will absolutely, for low income households, for local businesses, we'll keep making that case to government to back us, because that will then be the best way through the recovery when we get to that later in the year. And Nigel.
I think it was just to add something about what perhaps the hidden cost in terms of how we impact on the pandemic. So adult social care, for example, which is obviously on the rise already, and is already a budget pressure with these situations about COVID and social distancing regulations, etc. That really does start to impact on the cost of delivering those particular services. So the cost of those increases people don't necessarily see. And I know we saw early on in the pandemic things around the waste services and the challenges around maintaining social distancing while delivering waste services. So it's not always obvious where those additional costs occur. And it's really important that people understand that we're having to measure those against, at the same time, as Debbie said, really quite significant drops in terms of the income that we would normally expect to receive.
Thank you very much for that. We also received a couple of questions in advance on the actual budget proposals. So, for example, I saw that the budget proposals have been published. Could you give us an idea of the main headlines and how I can see them? And we've also had a question on Facebook, which is raising council tax when we're struggling daily. Is it to cover the debt you have? So perhaps if I go to you first on this one, Nigel, to pick up that headlines in the main budget where people can see them, and then I could bring Debbie in as well to pick up that point about the increased costs on the council this year. Nigel.
Yes, I think the headline, as we said, is the increasing raising costs. So we originally set out with what looked like a £12 million budget gap, and that is predominantly to answer the question. That is not around particularly around increasing debt. It is about increasing costs of adult social care and increasing costs in children's social care. That's where our budgetary pressures lie. In terms of bridging that gap, we have been able to deliver around about £8 million worth of savings. We focus those around back office and trying to protect frontline services. So of those 8 million savings, nearly half of those have actually come from those back office functions to try and protect those frontline services. And what we've done is really try to invest in where our most vulnerable people are, where vulnerable adults are, where vulnerable children are. So we will actually see a net increase of £2.6 million in adult social care and children's social care. We've also had to look forward and be prudent. We know the pressures, well, we knew going back in December that the pressures of COVID would continue into 2021. I think we've seen already this year that those pressures are probably going to be more significant than we initially thought at that point. And that's why we put money into the budget in terms of making sure we're able to cope with those. So we do have a £2.5 million revenue support towards our COVID impact, which does allow us to provide support for mental health. So there's about £100,000 in there to help the impact of mental health. There will be support in there for businesses. We have got support in there for carers, and acknowledging that the council tax system, which is not something that I'm particularly in favour of, is a regressive tax and doesn't actually hit on those that can afford it the most. We have looked to put mitigation into that budget to allow us to be able to support those on the lowest income and make sure they're not hardest hit by this particular amount of increase.
Thank you very much. Debbie, did you want to come into that point about increasing costs on the council?
Yeah, there are a number of areas where costs are increasing, but it is predominantly in adult social care. There are some inflationary increases and other things on contracts, but the main areas of investment and growth that require us to increase council tax are around investment in adults and children's social care, the costs of COVID, and that kind of area. One of the questions was about covering the debt. There is an element of the growth that we've put in, just about £1.5 million, that is the ongoing cost of managing the council's debt, but that's a relatively small proportion really, and it's not the predominant reason for the increase or the growth, because that funds that ongoing investment in some of those key capital projects, investment in highways, investment in a whole load of areas, initiatives to tackle climate change. So there are a whole host of capital investment that's ongoing to accelerate recovery and that kind of thing as well. So it's the cost of debt is one of the factors, clearly, but it's not the main reason.
Thanks. Nigel, did you want to come back in?
Yeah, I think Debbie led me into that one because I was reading the questions on there. The next question I think was around empty shops as well, onto that point, and it was about saying that 1.6, that investment in debt is investment in capital, and that's a £600 million capital programme that will be absolutely essential to the regeneration and driving the city forward going forward. So that is things like York Central, that's things like the York Outer Ring Road. It is the investment in the city centre, the Castle Gateway. The shop vacancy level in York is lower than it is nationally. I think the ones owned by the City Council, we have relatively few shops that are actually open. What we can do to make sure that we reduce the number of empty shops is to make sure the city centre is a place that people want to come and people want to work and people want to shop. And those key city centre regeneration projects will be absolutely essential to that. So driving forward the master plan from Castle Gateway, the Guildhall project and York Central will be really key to making sure the economy is in the right place as we come out of the pandemic.
Thank you very much. We also received some questions in advance on what is the council doing to get more money from the government to help us to recover from the pandemic. So if we could pick up on that question. And we've also just had one through on Facebook Live from Kath, who says, CYC have announced they are having to make savings of 7 million. Staff, particularly support staff, have been invaluable, especially in the community. Please, can you make some assurances that funding to support their work will be maintained and that antisocial behaviour is still a priority? So if you, Nigel, if you could address that, what are we doing to get more money from the government, but also those assurances for Kath's question?
So I think, as you alluded to earlier, Keith, we did set out the Back York campaign quite early on, and we've been very vocal in terms of where the gaps are in government support. We were very quick, for example, with the business support grants, acknowledging the fact that the initial round of business support grants didn't cover all of the businesses in the city and actually nationally. And there are still, I think, I alluded to, around £3 million that are excluded from support. But we acted quickly to make sure that we put £1 million of our own money into that to support those small and micro businesses that missed out. Through that lobbying that we did, in the second round of funding that came through from government, that was acknowledged, and a second round of grants did include those. As I say, there were still around about 3 million people are excluded, but we continue to look at, in essence, trying to fill those gaps as we see them in terms of government, but also lobbying strongly to government to make sure that funding is coming through to us. As you said, we were initially promised all the money we needed in terms of our response and to go out and do what was needed. That's not always been the case from government, and we continue to lobby and push for that to come through. In terms of acknowledging that, frontline staff have been absolutely essential to the way we've responded to the pandemic, and I think it's been, in many ways, a lesson to those in national government, just exactly what an important role local government and local government staff do provide for this country as a whole. And as I say, we've tried as much as possible to make sure that we've protected frontline staff and take as much as we can from sort of that back office and efficiency type function as we possibly can. I think in terms of those local community responses, that's something that we have always valued as an administration. We've always seen that local solutions to local problems are the best way forward. We continue to support those local solutions, and this budget also includes £200,000 to go straight towards those local communities to allow staff on the ground to be able to respond to the need in their own communities.
Thank you very much. I'll bring Debbie back in just to pick up that point about the fact that obviously we're having to make savings, many of which we would obviously much rather not make, but because of the financial position that we find ourselves in and that the government hasn't helped to that degree. But I'll bring you in the figures, and then I wonder whether Fiona or Maxine, one of you'd like to say something about that comment on staff and particularly support staff and everything that they're doing in the community. But I'll mention that here first before you do. Debbie.
So sorry, Keith, in terms of the support that we've had from government,
and the fact that we're having to make that level of savings.
Yeah. So we have had some support from government, but for example, in terms of our loss of income, the government is only covering 75% of the loss of income. So 25% of it, we still have to cover ourselves. So whilst the funding that we have is absolutely welcome, it hasn't been enough to cover everything that the government and that we've been required to do to support our residents and communities. And the savings that are needed, there's a balance here in setting a robust budget that is prudent and that balances and that's responsible. And so it is necessary to make savings and increase council tax, and it has been for everybody a very difficult year. And I think the proposals that have been put forward are doing their best to manage overall our financial position so that impact on residents is minimised wherever possible, and that we've concentrated making sure that investment in those frontline services, and that's why we've made so many back office efficiencies.
Thank you very much for that. And then just picking up that point about how important support staff have been, I think we've seen from key workers, critical workers, and whether that be social workers, the crews collecting waste, those in supermarkets or the NHS, just to name a few, just how crucial that they have been and are going to be over the weeks and months to come. So I don't know if I go to Fiona first on in the public health and NHS, and then I'll ask Maxine in terms of schools, whether you wanted to mention anything on that.
Yeah, it has, it's been an incredibly difficult time. And, when we were in lockdown earlier in the year and now we're back in lockdown again, but we still have vital workers within our city who have to go out and continue doing their roles. And obviously we're extremely grateful for that. And, one of the things that we will start to be doing now is to look at what additional support we can give to those workers, particularly around access to testing. If they're finding themselves in that situation where they can't follow the stay-at-home guidance because of the role that they're having to do, and particularly workers now that are kind of working in that key role in terms of helping us with this pandemic, and particularly vaccine rollout, which I know we're going to come on to talk about later. But all key workers really are vital to keeping our city going.
Maxine.
Yeah, I'd echo what Fiona's saying. Obviously, our early years providers across the city are playing a crucial role in allowing those other parts of the critical workforce to actually be able to go out to work, as are our schools. So, you know, it's very important to recognise that despite the fact that we have got a full national lockdown, and the message from the Department for Education is that schools are closed, obviously, as with lockdown 1, they're not. They are still providing a vital service to critical workers and to vulnerable children. So schools are open for those children and allowing their parents to get out to work, as are our early years settings, which are fully open and doing a really vital job. And obviously the support teams within the local authority that are supporting those settings and schools to be open are doing a very, very valuable job at the moment.
Thank you very much for that. I think that's probably a good opportunity in mentioning early years and schools, to say that we had quite a lot of questions in advance on that, and obviously it's very much been in the news, and with the change of national policy recently. And we had a question in advance from Katie, who asked, I just wanted to know when the scientific evidence for why primary schools can shut but early year settings can't will be released, because currently all early year settings are doing is putting staff, children and families at risk. I also wanted to know why the government continues to ignore us. None of the early years staff feel safe, and schools have the backup of unions, but we feel like we have nobody. We wanted to know what this government is planning to do to help us, as we feel undervalued, unsafe. So if I could go to Maxine first on that, and then whether Fiona wanted to comment as well. Maxine.
Yeah, obviously I will leave it to Fiona to comment about the public health evidence around the early years and the scientific evidence. What I would say is that the early years providers have their own professional associations who have been lobbying government and meeting very regularly with governments to ensure that their questions are answered about the response to the early years sector. What I would like to say is that there is no way that the early years settings are undervalued in the City of York. They're seen as a very key part of the infrastructure which the city has to support critical workers and all families. And we do see access to early years settings as crucially important to ensure that children get that best start in life. So they're a very valued part of the community, of the broader education community in the city, and do receive our thanks for the work that they do on a very, very regular basis, whether that be from elected members working in their wards to the council's executive as a whole. And you know, the council plan does have a priority around the early years, as does the health and wellbeing strategy that the city has. So in no way are you being seen as lesser to the schools in the city. The decision, though, was taken nationally by the Secretary of State around the status of different parts of the sectors, and the Secretary of State, you know, did confirm that all early years settings should stay fully open for all children, not just the children of critical workers and the vulnerables, and that was as I say, it's a national decision. It's not a decision that was taken locally. What we would say, though, is that locally, what we know is that our early years settings and providers have worked really, really hard on their control measures, and follow fully the advice that they get from the city's public health team. And that gives a level of assurance around the safe operation of those settings. I'm going to bring Fiona in here around that, because we work very closely across education and public health around ensuring that consistent advice is provided to the early years sector.
Yeah, so I think firstly as well, one of the things to say is that in terms of young children themselves, we do know that in that sort of preschool age group, we see much lower sort of rates of infection. So for the children themselves, transmission is lower. However, I do appreciate for staff who are working in sites, obviously, they will be worried about their own risk. So as Maxine said, we work closely with the sector to look at all the mitigations that we can put in place within those settings. So obviously, it is about risk mitigation. We cannot say that the virus will not transmit in any location. So it's about how do we minimize risk. So all of the work that those settings have done around the risk assessments. So, and it does just come back down to some of the very basic measures that we've talked about throughout the whole of this pandemic. So the hand washing, social distancing. I know that's not possible if you're a staff member working with young children, but in terms of staff to staff, keeping that social distance so that they're protecting each other, because what we find mostly is that when we do have outbreaks, small outbreaks, either in nursery or school settings, often it's more that it's either the children who've been infected by a household member, or it's something that's passed between the staff within that setting. So those measures between staff in the setting, which I know that you're all following, are still as important as ever. So as much as we can do from a public health team to support with those measures, we'll continue to do that. And then obviously, we have national contact tracing now, but we also have our own local contact tracing service. So when any setting gets a positive case notified, we then do all we can to support that setting to make sure we identify any contacts and that the advice around isolation is followed quickly, so that we can break those chains of transmission, so that we don't have escalating outbreaks. And what we can say is we haven't had settings that we've had to close because we've had outbreaks that have got out of control.
Thank you both very much for that. A question that linked to that we received in advance, and again particularly reflecting sort of part closure of schools, was what resources are there to help teach my children at home? And if Maxine, you could do that one.
Yeah, there's a range of national resources available. The key one being the National Oak Academy, which the DFE put in place during lockdown 1. That has quite extensive resources, and it is broken down by key stage, and it is possible to log on there to actually access all of those resources. The BBC obviously are now ranking up their efforts as well through their resources and through BBC Bite Size. But the first port of call is the offer by your own school. And all our schools have their remote learning offers in place now. It is statutorily the case that now schools have to provide a remote learning offer to all children and young people in the city. For primary schools, that's an offer of 3 hours a day, and for secondary schools, a minimum offer of 4 hours a day. And as I say, that's available via the arrangements that your schools should have communicated to you in the last day or so. They also as well are making available extra devices for children and families who may be finding it difficult to have access. And it's all you need to do is contact your school to let them know if you're having problems with that, and they're able then to put in place access to additional resources, and also to provide you with a device that will help you to access what they've got on offer.
Thank you very much for that, Maxine, and welcome to Phil, who will now have joined your Facebook screens. Very welcome. A question that came in advance that I'm going to ask you to answer, Nigel, was what support is there for businesses who have to close? As obviously there are new business grants now available that were announced yesterday, but still a lot of concerns that some businesses might fall through the cracks, so to speak, as to what support they need. But we've also had some questions on Facebook Live. So, for example, Leslie's asked, why are council tax increases increasing way above inflation? Wages do not go up by 5%, and that council tax increases should reflect inflation. So I wonder if you could pick up both of those questions. That would be great.
Thank you, Keith. Yeah, I had picked that one up as well. I think it's one of those things one of those questions before I was a councillor, I often thought myself, why do council tax increase above inflation and often so far above inflation? I think the reality is that the services we provide aren't something that is defined by an inflationary unit cost, as perhaps we see as we go to the supermarket or insurance, etc. It is about the number of people we support. 2/3 of our budget goes on supporting vulnerable adults and vulnerable children. And if those numbers increase, then the cost of providing care increases. And it's not something we can do to step away and not provide support to some of our most vulnerable. So it is a complicated situation. And I think it's not the way perhaps adult social care should be funded. So we were well aware that the Chancellor did announce that there would be a 4.5% increase in spending power. But what he meant was he was shifting that burden onto local taxpayers. It's not something we support. We're fully aware that council tax is one of the most regressive forms of taxation. It doesn't impinge on those who are most able to pay. That's why we've tried to do a little bit of something about trying to support those who are hardest hit by it. But really what is needed is social care reform, so that we actually find a better way of supporting vulnerable adults than expecting council taxpayers to pick that up. But at the moment, the government is failing to address that, and they themselves are passing that burden onto taxpayers, which is unfortunate in our local economy. In terms of businesses, I have a huge amount of sympathy for businesses. They've been going through a really difficult and tough time, and we, as I mentioned earlier, we stepped in as quickly as possible to offer as much support as we possibly can. The government has stepped in, and they have set up a system of grants, and I think it has been quite complicated and quite difficult for businesses to navigate their way through, and I think it's very important that we use our outlets through Make It York, through the LEP and things like that to allow that business support so people can get that. Those people that have already received grants, and I think we're one of the quickest paying local authorities in the country in terms of getting those grants out, they're now within our system. And so the good news for those is that if you're already in receipt of grants, as the new grants come out, we'll be able to pay those straight through to you without you having to apply again. If you haven't received a grant, or you haven't been eligible, or you think perhaps you may now be eligible, I would really urge people to get in touch through our business support, through our business bulletin, etc., through Make It York to find out about that. We do still wait to see. So the latest announcement from government was an extra £4.6 billion in terms of support for businesses. That will lead to grants of between £4,000 and £9,000 as a one-off payment for this particular period. It was initially stated that that will be on top of the lockdown support grants that people are already receiving, but we do still, again, await further confirmation of that. So we will ask people to be patient with us around that period. But as I say, we have the additional restrictions grants in there. So those that aren't necessarily receiving support at the moment, there is a certain amount of discretionary funding that the council can do. We have criteria set up to support those businesses. That can be things from mobile hairdressers to people like taxi drivers who've been in contact with us, or market traders who haven't been able to apply for some of the more national grants. That is available. We are reviewing that. So there's further funding coming through as a local authority to expand that scheme. So we will be looking to do that. There is a meeting on the 18th of January, I think, my decision session, which will be looking at how we review that, and we'll be able to get more details out. But I think there is a wealth of support out there. It is something of a maze to find your way through it. But I really urge people to get out there and ask for that help and ask for that support.
Thank you very much for that. We've had now through on Facebook Live and in advance a lot of questions about the vaccine rollout. So I'll start to go through those questions in a second. But before I do, I wonder, Fiona, whether there's any general comments you wanted to make about the new national lockdown and the restrictions. Fiona.
Yeah, so I mean, I'm sure everybody is aware of this, but obviously the general message is stay at home if you're able to. Obviously, there are some circumstances, and we've talked already about key workers who have to go out to work. but essentially the only reasons why people should be leaving home is to do exercise on a daily basis, trying to keep that as local as possible. You can meet with one other person if you need to do that exercise, but actually I would be thinking about, actually, do you need to meet with someone, or can you do that by yourself? As little mixing with other people at this moment in time is really critical. And then obviously going out to get food and supplies or to seek medical attention are allowed within that guidance. So I think really the really clear message now is that we're in a situation that has been worse than ever, really, throughout this pandemic. So now is the time that we all really need to take this seriously and think about what we need to do each at an individual level to stop the spread of the virus. We know that we have a variant of the virus which is more transmissible than before. So, you know, if you feel like you did activities before that were not quite in the guidance and you got away with it, you might not get away with it this time, because this virus is much more transmissible. So we're going to talk about vaccines. So, you know, it's good to feel that there is some light at the end of the tunnel and some hope that we can look forward to, but unfortunately it's not quite now. So we all need to have this kind of concerted effort to get through these next sort of 4 to 6 weeks, which I think are going to be really critical for us, and particularly for the NHS as well.
Thank you very much. So we had a couple of questions in advance on the vaccine, and I'll group them all together and then go to Phil first, and then back to you, Fiona, and likewise, Phil, whether there's any general comments you want to make first from the CCG, please do. So the first question was, when will York have access to the wider vaccine rollout? And the second question we got in advance was, there's been a lot of speculation about the vaccine on social media. Is one vaccine better than the others? And then I've just seen on Facebook a few more questions about the vaccine. For example, from Joanne, where is York in relation to vaccine rollout? We seem to be behind many of the rural and large city communities. When do we anticipate the pace to pick up? And from Mark, who is responsible for choosing and finding vaccination sites? Is it CYC or the CCG? So that just gives you an example of some of the questions that are coming through on the vaccine. And if I could go to you first, Phil.
Thanks, Keith, and good evening, everybody. The number of questions about the vaccine are really understandable, and with it being such a fast moving development, I think perhaps something we could think about doing for future, Keith, is many of the questions will require a professional medical response in terms of insight and assurance. So we may want to think about how we set something up along those lines in the weeks ahead. I was speaking earlier this afternoon about something else, actually, to one of the GPs who's leading the approach to vaccines in York. That's Dr. Michael Holmes, who may be familiar to some of you. And Mike is already using social media, York Press, and the radio in York to communicate the changing picture that we have with the vaccine. And so maybe inviting Mike and or one of his colleagues to join us in future would be helpful. In the approach that has been taken is being led by the NHS. In terms of the question about who decides where, the way that the NHS is approaching this is through something called primary care networks. So our general practices that we have in the city have formed networks to help them do things at greater scale. They're called primary care networks, and within York we have 5 of those. And through the NHS, the discussions were held with those primary care networks about how to mobilise and create an effective way of starting to create sites which would give us our best chance of effectively working through the supply chain as it starts to come on stream. So what we have at the moment is a proposal that there will be 2 sites in York that will be the focus of attention for those primary care networks, acting on behalf of all our general practices. One of those will be at Aspden, which many people will already be familiar with. The other will be at Haxby. Just in terms of the question about is York behind, I wouldn't recognise that, actually. I think the infrastructure in those 2 sites is likely to become one that others will want to try and replicate outside of York in terms of the scale of the offer that it creates, and therefore the number of people that we can start to vaccinate through that approach. The way that we approach that, of course, was set out by the Prime Minister last night in terms of that February aspiration target and the at-risk groups that were set nationally, and that is what we will be following locally. For NHS staff in York Hospital will be doing that for its own staff and is mobilising that now as well. Our understanding about when we start to receive supply of the AstraZeneca vaccine is we're hopeful that will start to come on stream in the next few weeks. Supply is determined nationally, not regionally or locally, so we just have to be ready. We have to be ready in terms of our understanding of the management of the process, and also in terms of the flow, so that we can be as effective as we can. And as I would suggest that probably in 2 weeks, as that supply chain starts to move, then those 2 sites that we have, if we asked a representative of those 2 sites to then carry out this sort of conversation, Keith, I think that would provide the information and assurance that people will be looking for. In terms of the speculation about is one vaccine better than the other, I'm not professionally qualified to respond to that. I would encourage people to listen carefully to the Chief Medical Officer, Chris Whitty, in his regular briefings. On a personal level, I will take the vaccine as soon as it is offered and available. And I know many of my professional colleagues feel the same. But of course, it is a personal choice, but a choice that should be significantly influenced by the professionals who are closest to this, who over many years we've always trusted, and there's no reason why we shouldn't trust their view now. I'll just pause there, Keith. Thank you.
Thanks, Phil. And I agree. I think it would be a great idea on the next Facebook Live to invite a GP representative to pick up some of those questions. Fiona, is there anything you wanted to add about the vaccine rollout?
No, I mean, I suppose the only thing just to add in terms of the numbers, so, yeah, I can understand people would, like to sort of see, how many people in York have been vaccinated. So all we have at the moment is numbers at a national base, on a national level, but I am led to believe that Public Health England will begin shortly to publish a dashboard which will show areas at local authority level, so you can kind of see what the rollout is doing. So as soon as that becomes available, that might be something that we could look to share through our open data that we do weekly at the moment. So we'll keep an eye on that.
That's great. Thank you very much. One question that's come up on Facebook Live, which relates to the guidance, is from Debbie, who's asked, my partner is being told he has to attend work, even though me and my daughter are clinically vulnerable, but don't have a letter yet. Is this right? So if I go to Fiona first, and then Phil, if you've got any comments, you can always raise your virtual hand, and I'll bring you in. Fiona.
Yeah, so the advice for people who are on the clinically extremely vulnerable list is that they shouldn't attend work and work at home. Obviously, you know, this is for your partner, so he's not himself clinically extremely vulnerable. So I understand, you know, that puts people in a difficult position when they're worried about, you know, partner going out, potentially getting infected and then bringing it back into the home. So the only really advice around that is to just follow all the guidance that talks about how you can make your home more COVID secure, and that's available in the government guidance. So, you know, obviously, you know, within the household you won't be doing social distancing, but there are other measures that you can take, just thinking about your home environment and how you make that as safe as possible to reduce your risk.
Thank you very much for that. Phil.
Yeah, just to say about the letters. So the letters will come. The determination of the prioritization, of course, we've only just received that in the last few days. Our colleagues in general practice are currently open for business, but saturated with normal winter respiratory disease demand for their care and attention, which over the last few days we've seen a significant amount of trauma through trips, slips and falls as well. And those colleagues are also then contributing to making sure that they are trained and able to give the COVID vaccine. So there's a significant amount of juggling going on over the last 2 or 3 days in primary care. The letters will come, so please be assured, Debbie, that the letter will come. It's just where there's an understandable, I hope people will understand, an understandable lag of a few days at the moment. So just bear with us, it will come.
Thank you very much. I'm going to flip topics now, as we had a question in advance, which was, will my bin still be collected during the national lockdown, and can I still use the tip? So I'm going to direct that question to Nigel in a second, but linked to that, we've had a couple of questions on Facebook Live, which relates to Phil's last comment, which and an example from Rob, can you get the gritters out please, as it can be a hazard waiting to happen. I've not seen a salt spreader, which would mean more pressure on the NHS. If you could pick up those points sort of about frontline waste and highways services, Nigel.
I think so. Picking up on the gritting thing, first of all, obviously it's been a particularly cold snap that we're in, and I think one of those things people do often say they haven't seen the gritters, but I think to reassure people, they actually absolutely are out there. So I think 22 times this season they've already been out in terms of gritting, and we've used over 1,000 tons of salt in terms of getting that out. We do have 9 large gritting vehicles and 3 smaller gritting vehicles, which allows us to get into some of the smaller streets. And to reassure people that each time those vehicles go out, we're covering around about 390 kilometres of roads, footpaths and cycle paths. So I think that most definitely is happening, and I think those crews are starting often at 4 a.m. in the morning, so that may be why some people don't necessarily see them going about their daily business. So I think to reassure people, we're gritting absolutely as much as we possibly can in terms of resources we have. But I think also there is an opportunity for local responses. So particularly in my ward, salt bins are available, and I think I was able to encourage people to contact their local councillor. So as it was, I was contacted by one of my residents on Monday who said they had a particular problem in the street. Is it possible to get a salt bin? I was able to speak to the council using our local ward committee funding, and within 24 hours that salt bin was out in situ and salt was available. So there is the opportunity for local response as well as that wider, broader response that we have as a local authority. In terms of those services that are available, I think caveating everything with the situation that COVID is a challenge, and we saw back in the original period of lockdown that the particular issues about can put strain on council services, but your waste services will continue as usual. You may see instances of commingling if that is a occurrence due to staff absence and the ability to get around and do those. So I think be certain about that those services will continue, though there is a possibility that you may see some level of commingling. Highway repairs, etc., will be continuing on with essential repairs and continuing with winter gritting. Unfortunately, something that my son, etc., is disappointed with, outdoor gyms, sports area, basketball courts, outdoor gyms, etc., are not able to open at the moment, though play areas can. And our household waste services, both Hazel Court and Towthorpe, will continue to remain open. In terms of our library service, York, Acomb and Town Hall are both available for public access to PCs to ensure people can access those services if they need to.
Thank you very much for that. And I think it will have been added to the comment section, but on gritting, if, for example, you're on Twitter, you can follow York Gritter to find out when they're going out and where they're going. So have a look at that if you are able to. An eye on time as we're down to 10 minutes, but I do want to get through and cover as many topics as possible. I'm going to go back to the topic of education and schools, as we've had a question on Facebook from Lucy, which is how are you going to support special educational needs children and families throughout lockdown when the special educational needs school don't have enough staff to stay open at the moment? Maxine.
Yeah, thank you for your question, Lucy. There is, at the moment, Hobmore Oaks Primary Special School has had to close some of its bubbles. That is a temporary measure. It is just to do with some short-term staffing issues at the moment. The school's management team are working very hard to resolve those quickly, and hopefully that we do get a resolution to that in the next couple of days. Obviously, it does take time to support to source additional staffing while they're putting those measures in place. Also, we've put out additional communication from our SEN services this week through the Children and Families newsletter, which is going out in the next couple of days, about staying in touch with your SEN designated officer and making sure that they're aware of any problems that you're having. There are extra resources being put out through the local offer as well to support you. And again, your school will actually be putting remote resources together for you to access. So it's important to make the SEN services aware of any particular issues that you've got, and we'll work with you to try and support you with that.
Thank you very much for that, Maxine. And I'm now going to go back to the topic of business grants that we were talking about earlier. As again, there was an earlier question on Facebook, which I think followed the answers, which is, can the handing out of grants be simplified, as this would be easier rather than missing out? So potentially Debbie or Nigel could answer that one. Who would like to go first? If not, I'll go to Nigel first, and then you can always add anything, Debbie, afterwards. Nigel.
Oh, Debbie was unmuting then, I think. There are certain hoops that we have to run through, I think, is one of those frustrations that we do have. So as it's government funding, there are certain processes that we have to follow to enable the necessary fraud checks, etc. can be done. So there is certain limitations about how much we simplify it. We have tried to simplify it as much as possible. And as I say, for those people who have already applied, they won't need to apply again. So it's just a simple case of them receiving the funding. So we'll get that out to them as soon as possible. For those who haven't received, if there are any comments that they would like to send through to me in terms of how the process can be simplified, I'd be more than happy to discuss that with them outside and let them know whether that is or isn't something we're able to do.
Great, thank you very much for that. So I think with an eye on time, I will start to draw us to a close. If anybody wants to make any last comments, please raise your virtual hand and I'll bring you in if you haven't had the opportunity to do that. But I completely agree, Phil, that on the next Facebook Live, which I'm sure will focus on those national lockdowns, public health and health response, it would be good to get some other partners on to answer some of those questions, which I'm sure is something we'll take away and organise. I'd just like to say a big thank you to everybody that's asked a question today. That's whether you submitted them in advance or you've been involved and asked them on Facebook. It's really important to hear your questions and your views. And please do keep an eye out for future Facebook Live Q&As on other important topics, because as I mentioned at the very start, we are going to make sure that we regularly repeat these throughout the national lockdown, as we have been doing. I'd also very much like to thank our panelists this evening for giving their time and insight. And I do want to flag that if you do have any views and comments on the issues we've discussed this evening, do get involved and share your views as part of our big conversation, which is the current council consultation, as this will help the council to develop our approach to many of those big issues that we're facing. I also like to just repeat that offer of help and support at the very start. If you know of anybody that requires support that isn't getting it at the moment, do contact us. And again, the helpline 01904 551 550, or you can email covid19help@york.gov.uk. Please do continue to leave your comments and questions in the comment box. As a member of our communications team will respond, whether you're watching live or you're watching afterwards. And just a final thank you all for joining us tonight, and I hope you have a great evening. Thank you.